Hi class, welcome to EdVantage. I'm Dr. Jody Richardson Delgado. Today we're going to be talking about therapy. So therapy treats a lot of different things, such as job stress and burnout, family issues, physical health, relationships, addiction, and many other issues. What does therapy look like? Well, therapy used to look like this. This is actually a picture of the couch that Freud would have his clients lay on, and he would sit in that little green chair and he would analyze dreams and do a lot of the psychoanalysis that we hear about from psychotherapy. We're going to start with insight therapies. There's 4 major types of insight therapies. Now, with insight therapy, this is about gaining insight into what is causing the issue for you. So there's psychoanalysis or psychodynamic therapy, there's humanistic therapy, cognitive therapy, group, family, and marital therapy. With psychoanalysis or psychodynamic therapy, there's major techniques that we look at that were developed by Freud. One of the techniques that a lot of people know about is dream analysis. And of course, this is where you would lay on the couch that you saw in the previous picture and talk about your dreams. And Freud believed that this was the unconscious bubbling to the surface. And through examining our unconscious, we could really understand what it is, the root of our issues, and what it is that we need to explore. Free association is where the therapist will say a word and the client will say the first word that pops into their head. So the therapist might say green, the client says brown, the therapist says tree, the client says flowers, the therapist says river, and the client suddenly says, my father pushing my mother in the river. Now we've had a breakthrough. And that's kind of what happens. You get into a very relaxed state and you go back and forth with the individual, and eventually it is hoped that the unconscious will bubble up to the surface. And of course it doesn't happen that quickly. That was just a funny example I was giving. But that's kind of the idea of free association, is allowing the client to relax enough that the unconscious will reveal itself. And then we can explore what the unconscious is dealing with. Analyzing transference. This is when often you'll see clients transfer maybe some of the anger that they're feeling towards their parents onto the therapist themselves. And so we want to analyze what some of that anger might be about. Analyzing resistance. This is another idea where we want to analyze what is the client resisting. So we might bring up issues with parents, or the mother in particular, because Freud talked a lot about mom. And we would want to talk about mom, and we might ask questions about mom. And the client quickly changes the subject or says, oh, I don't want to talk about that right now. That's resistance. And Freud believed that was an unconscious mechanism for really guarding ourselves from dealing with the pain of maybe that relationship or an issue that has happened with the parent. And so we want to analyze what that resistance is. Why is it that you don't want to talk about your mother or that incident from your childhood? There are a lot of pros and cons to psychoanalysis. Some of the pros include we're going to explore the unconscious, and we do a lot of things in our life that we're not fully aware of why we do what we do. It also explores our childhood and our past and brings it to light as to how our past might be influencing our present behavior. Some of the cons include limited applicability, and scientific credibility is not that great for this. So these are 2 things that we really have a hard time looking at scientifically. We haven't been able to do a lot of scientific studies on psychoanalysis. Another form of insight therapy is humanistic therapy. This really talks about the human growth and the human potential. And the belief with humanistic therapy is that our problems arise from blockage or disruption of our normal growth potential. So there is the idea in humanistic therapy that an individual has a growth potential, and it's a kind of a natural curve that we all have. But problems arise when we are blocked from our goals. This can be partially due to a defective self-concept. So the idea that there's something we believe that there is something wrong with us, or that our experience that we're having in our environment doesn't match our self-concept. It's called incongruence, and this is a big problem as well. And the therapist will go in and talk about the congruence of the concept of the self as well as the experience. So for example, if I believe I'm a good student, my self-concept is I'm a good student, but I'm not passing my classes, I'm getting D's and F in my classes, I have an incongruence there between my self-concept and my experience. And this is where the therapist would go in and talk about adjusting some things and working with the client on that. Rogers was an individual who really revolutionized the way that we do therapy today. He emphasized the natural tendency of a client to become healthy and productive. And he was the one who talked about client-centered therapy. Before this time, it was thought that the therapist was the expert, and the therapist would guide the client into analyzing their issues and their problems. And Rogers really talked about the client is the expert of themselves, and they are the individual that needs to really take lead in the therapy sessions, and they are the ones that need to resolve their issues. This requires a lot more work on the part of the client. They have to be very active in the process, and sometimes they're even given homework to do at home besides analyzing or recording their dreams. This might require that they really take stock of their goals and look at their environment and see how they're interacting with the environment around them. Rogers also looked at active listening, and he talked about how to be an active listener, really paraphrasing and trying to get an understanding of what the client means when they are talking. Sometimes we say things and we think we are clear in its meaning, but it doesn't come across that way to the other person. And Rogers was one that talks about this active listening, being an active part as a therapist of understanding what the client is saying, not interpreting what the client should mean or does mean, but allowing that client to clarify what it is that they want to express. So there's pros and cons to the humanistic therapies as well. Some of the pros are there's an evidence for success. We do see a lot of clients that go through humanistic therapies report that they feel better, they have less issues with whatever it is that they are working on. Some of the cons are, again, the scientific credibility. How do we measure self-actualization? How do we measure some of these concepts of humanistic therapy and this growth potential that someone isn't achieving? Another form of therapy is cognitive therapies. These focus on faulty thinking and beliefs. Albert Ellis and Aaron Beck were two therapists that really studied this. You may have heard of the Beck Depression Inventory. This comes from Beck. And both of these individuals really studied anxiety and depression, and in particular studied a lot with depression, and found that a lot of our thinking and this loop of negative thinking that we get into can really be problematic for us as we are trying to resolve issues for ourselves. So with rational emotive behavior therapy, or REBT, we see that there are the ABCDs of therapy, so lots of acronyms here. But the A is the activating event. The B is the belief that arises from that activating event. The C is the emotional consequence of that belief. And sometimes we can get caught in this loop between the B and the C. And what Ellis really talks about is that we need to dispute those negative beliefs that we have so the emotional consequence doesn't come out. So the D stands for disputing irrational beliefs. So an example of this might be an activating event. A student gets a bad grade on an exam. So that has happened, and the belief comes up. Oh my gosh, I'm never going to pass this class. I always do bad on these exams. So this belief comes up, and then the consequence isn't I'm going to try harder next time. It isn't that things are going to somehow work out. It's, I feel sad. I feel frustrated. And then you go back from feeling sad and frustrated and you have another negative belief come up. And it's that loop that goes around that can be so difficult for individuals. So we want to dispute that belief. I'll never pass this class. I always mess up on these exams. And a lot of times with these irrational beliefs, we'll hear this always and never, kind of these absolute terms. And so that might be a place to start with disputing these irrational beliefs. I'm never going to pass this class. And so an individual might ask themselves, or a therapist might ask their client, so you're never going to be able to pass this class. There's no way you could ever pass this class. Is that absolutely true? Well, I don't know, right? You start to see a little glimmer of light, and that's really the hope with this disputing belief. I always mess up on exams. So you have always messed up on every exam you've ever taken. Well, no, sometimes I can pass an exam. And so that's really where you want to get in there, so you can move that emotional consequence from negativity to a little bit more positivity. You're not going to go from completely negative to completely positive, but that's the whole idea of this therapy, is breaking that cycle between the B and the C. Beck's cognitive behavioral therapy talks about this depressive thought pattern that we might have. And I talked a little bit about that in the abnormal psychology videos previously. So with depressive thought patterns, this involves selective perception, overgeneralization, magnification, and all or nothing thinking. So this is really selecting the negative aspects of our day. We find that people who have this depressive thought pattern often will select the negative experiences over the positive experiences when we ask them to talk about their day. Report on your day, and they're going to talk more about the negative things. Overgeneralization. They kind of overgeneralize some of the negative aspects of their experience. And then magnification, again, that's magnifying some of the negative experiences that they're having. So all or nothing thinking is when we think of things in terms of always and never, like I was talking about in the previous slide, when we get caught in that belief system of I'm never going to pass this class, I always mess up, and not seeing that there is something that could possibly happen in between. So this is another aspect that Beck talks about with this depressive thought pattern. There are pros and cons with cognitive behavioral therapy. There's been a lot of success with a lot of issues, such as phobias, depression, autism, lots of areas that focus on our rational thinking and our emotions, and how these two can work together to help us think and feel better. Some of the cons include it focuses too much on rationality, and we really don't explore the past. We don't necessarily get to some of the issues that someone might have had from childhood or something like that. So that's one of the cons that we definitely see with CBT. Other therapies include group, family, and marital therapies. Now, group therapy is when individuals meet as a group and work together on therapeutic goals. The idea behind this is that maybe individuals in the group all are working on individual goals, but they have similar enough problems or similar enough goals that individuals can learn from one another. That's one of the benefits, is learning from other peers that are like you. The other thing, honestly, that's one of the benefits is it's usually less expensive than meeting one-on-one with a therapist. Family and marital therapies are another form of insight therapy. Now, family therapy came about after medication was starting to be widely used in the 1960s and 70s, because we were seeing that clients were being rehabilitated in the hospital and going home, and then they were coming back. And we couldn't figure out why this was, and we realized that we needed to bring the family in, A, for education, but also to understand what the family system was that was working together. So with family and marital therapies, we really work on the communication and understanding the system of the family structure or the marital structure and working on those patterns. I hope this video has helped. Thanks for watching. Please click on the EdVantage logo and subscribe.